Hi everybody, it's John Shinn with Empower Brokerage. It's good to be with you today. Thanks for stopping by for this video session we have today. I've been with Empower a long time and I've been in the Medicare space over 40 years. So I'm happy to be here today and share some of the experiences that I have and bring you up to date on what's going on. It's a busy year, busy time. Really it's busy year round nowadays, but we're at a busy time where we have a lot of changes going on in January of each year. So I wanted to kind of bring you up to speed on that today and go over that. Today what I want to do is talk about the 2024 changes in original Medicare. This is a presentation that we have at Empower that we use to sell Medicare supplements, and we think that you'll find this very valuable yourself. So as you can see on the screen, I have the 2024 changes in Medicare Part A and Part B. We'll start off with Part A. This is an easy way to sell Medicare supplements and an easy way to explain Medicare supplements. So with Part A, as you know by now, Part A covers the expenses related to inpatient hospital stays. Part B covers the outpatient hospital stays, and I'll go more into detail as we get into that. But here's the main thing you want to remember. From day 1 through day 60, in the hospital, Medicare is going to cover most confinement costs after you pay the Part A deductible, which is $1,632, is what's called the inpatient Part A deductible. That's a per benefit period deductible. What that means is a person on Medicare would have to pay this deductible more than one time in a year. They're tied to benefit periods, which are 60 days in length. So someone could have to pay the Part A deductible more than one time. So that's really one of the main reasons to carry a supplement to Medicare. You'll see the next column here. If you have a Plan F, which still exists, a lot of people think Plan Fs are not available today, but they are to people who turn 65 prior to January the 1st, 2020. So we still see a lot of people that today that have a Plan F, and we're able to either quote that plan or to consider changing to a Plan G. So with a Plan F, you would pay $0. If you had a original Medicare and a Plan F, you would pay $0. The next column just to the right is the Plan G. If you have a Plan G, it's going to pay that same $1,632 deductible, and actually the Plan N. These are the three most popular Medicare supplement plan designs. So you can see they're exactly the same. They're identical in what they're going to pay. So the day 1 through day 60 in the hospital, all the Medicare beneficiary pays is this $1,632. And any one of these three Medicare supplement plan designs will cover that for them. Now the next line, you're going to see days 61 through 90, which it would be very rare that someone would be in the hospital that long, but if you were in the hospital, Medicare is going to cover all eligible expenses after the patient pays a per day confinement. And this year it's going to be $408 per day. If you added that up, that 60-day period, that's $12,000, over $12,000. So if you have a Plan F, a Plan G, or a Plan N, it's going to pay the copay, that daily copay. So here we are 90 days into this hospital stay. And it's worth noting that original Medicare, you can choose any hospital that accepts Medicare, which is just about all of them, I would say. And then the Plan F, the Plan G, or the Plan N is going to supplement and pay what Medicare approves but doesn't pay in full. So the next line that you would explain is days 91 through day 150. Medicare actually calculates that in, and they're going to pay all eligible expenses after the patient pays a per day copayment. In this case, it's $816 per day. And if you were to add that up, that's $48,900. So this is the reason people carry supplements to original Medicare. So with a Plan F, a Plan G, and a Plan N, it's going to cover those copays for the patient. So here we are, day 1 through day 150. And everything in the hospital is being covered 100%. It's going to pay whatever Medicare approves but doesn't pay in full. And Medicare supplements can pay beyond the 150 days. So 150 days plus, you pay all the costs, and these plans pay $0. So after 150 days, you're on your own, so to speak, the client. So as you read down through this piece of paper, this is designed to be an easy presentation to help you explain how original Medicare works and how 3 Medicare supplement plans work. So then we come to the skilled nursing benefit, which is the last piece of the Part A explanation, and you would just read this to them. Skilled nursing confinement following a hospital stay of at least 3 days. Medicare will pay that, but you have to be in the hospital at least 3 days and enter a Medicare-approved facility within 30 days after the hospital discharge and receive your skilled nursing care. Some people call that rehab, but Medicare is going to pay all eligible expenses. Original Medicare, for the first 20 days, the patient pays a per-day copay. That copay is $204 per day from days 21 through 100, and that adds up is the whole point. So one of the keys that I want you to understand on this page is that if you have original Medicare and you have one of these 3 supplements, they're all 3 going to pay the exact same. They're identical, no matter which plan, which state, which company. These are all standardized plan designs. So the next thing I'm going to show you, we're going to shift to Part B. And the way we use this, well, you can either have 2 pieces of paper, or you could have 1 piece of paper that has Part A on the front and Part B on the back. So it's really 1 piece of paper that you could explain how Medicare, original Medicare works, and how Medicare supplements supplement the original Medicare. So Part B is different. This is the part of Medicare that's going to pay your physician costs in or out of the hospital. It's going to cover your outpatient care. It's going to cover testing and supplies, lab tests, that sort of thing. Covers outpatient surgical centers, that sort of thing. So this is how this works. It's called Part B of original Medicare. And again, when you're explaining this, you're just going to come down, take your pen and just come right down this chart line by line and read across left to right. But we're going to talk about the annual deductible. And in this case for Part B, Medicare doesn't pay anything until you pay the Part B deductible. And this year, 2024, that deductible is going up to $240. That's an increase. And if you had a Plan F, which is the most comprehensive plan, it's not available to anybody who turns 65 after January 1st of 2020, but is still there. It's going to pay what Medicare, it's going to pay that deductible for you. If you have a Plan G, you pay the Part B deductible, which is $240. And the Plan N is the same as the G. But if you'll look down these 2 columns between F and G, these are the 2 most popular plans. They're identical. They're going to cover everything in or out of the hospital that Medicare approves, but doesn't pay in full. The only difference is the $240 annual deductible. It is worth noting that these Medicare supplement plans automatically adjust to the changes that we see every year with original Medicare. Typically every year we're going to see a change in the Part A deductible. This year it went up to $1,630. And then we're going to see a change in this Part B deductible. It went up to $240. And the way this works, this is actually an annual deductible. You only pay this once per year. It's usually the first few visits or the first visit to a doctor's office. You're going to pay the first $240. And then from then on, you'd go that second line and you would read that for physician services, inpatient, Medicare is going to cover 80%, and then you pay 20% of the amount. And then you're going to have your supplement to Medicare come in. The Plan F is going to pay that 20%. The Plan G pays the 20%. And then the Plan N that we won't talk that much about, you could have up to a $20 copay there, as you see. But mostly we'll focus on the Plan G today, the F and the G. And this is really an easy way to do it. So you would just come down. These are all outside the hospital. Medicare is going to pay, after you pay the deductible, that $240 deductible, they're going to pay everything. The supplement and the original Medicare is going to pay everything. Which doctor can you use? Any doctor. Which specialist do you use? You use any specialist. Do you need a referral from a primary care physician to see a specialist? No. These are very distinct differences and very simply the way original Medicare works with a supplement to Medicare. So clinical lab tests, home health care, outpatient. As we read down through this, you can see blood, everything's covered. Your copay, the main thing I want you to see is what you pay is you're going to pay $0 with a Plan F. You're going to pay $0 with a Plan G as you explain this to the agent. The only difference is that $240. So what other difference is? Well, the premium is going to be different, the price. So if you look all the way at the very bottom, if you just come down, you'll see age on the left. There's tobacco, non-tobacco. You'll see male or female, phone number. There's just a little place for you. Usually the agent prints this off and scribbles on this, and then you'll see the current carrier might be, let's just use carrier A. And the premium, we have a 70-year-old female, let's say, that lives in a metropolitan area. They may be paying $250 a month for that Plan F, and then we drop down and show carrier B, and the same exact identical coverage. That premium could be $50 a month less. So instead of $250, it could be $200. You might even see $175. But we're going to compare this to the Plan G. In that column, you'll see a place there for carrier B at the bottom of this. That could be as much as $100 a month difference. So the whole concept, the idea here is to show someone how they can go from a Plan F to a Plan G and save up to $100 a month. That's $1,200 a year, and we're going to pay that $240 out of the savings. So we just saved someone $1,200, and we're going to pay that Part B deductible out of that, which is $240, and we're going to come down under just a little over $900, and we're going to use that money to save. We can do that very quickly and easily. What a lot of agents will do there is they're going to use that money they just saved, somewhere between $950 and $1,000, and they're going to use that to pay the Part B deductible, and they're going to use that to buy home health care insurance or assisted living or dental insurance, final expense, all kinds of other things that you can do with that. Wanted to cover this with you today. This is Part A and Part B of Original Medicare by adding a Plan F, a Plan G, or a Plan N. And the way we get to the rates is we use the technology, software that we have available to you. We can show you how to pull those. We'll do that on the next video. But I hope this was useful to you today. I hope that you found some value in that. And we'll see you on the next video. Thanks for stopping by. Well, thank you for watching. I hope you liked the information today. If you want to reach out with any questions, just give me a call. You can find my information in the description below. So don't forget to like and subscribe so you can stay up to date on all things Medicare.